On the UpFront segment tonight, a closer look at the state of hospitals and health systems in Michigan as this pandemic rages on. Joining me now is Brian Peters, CEO of the Michigan Health and Hospital Association. Brian, thanks for the time tonight. We appreciate that.
Good evening. Thanks for having me.
Let's start with where we're at tonight in terms of hospital capacity statewide and the ability for health professionals to treat the growing number of COVID patients.
Well, we've certainly heard some of the very concerning numbers in terms of the total number of Michiganders who've tested positive for COVID in recent days, and certainly the number of deaths, which indicates how very real and serious this issue is. But I'll share another number with you, and that's 4,300. That's the number of Michiganders who are currently inpatients in our hospitals being treated for COVID-19. And where this issue was really centered on Southeast Michigan during the first surge earlier in the year, currently this is a problem that's confronting hospitals throughout the state of Michigan in both urban and rural communities. So it is a real concern.
Is there a region that is particularly challenged right now, tonight, in terms of capacity and perhaps staffing to go with that?
We've been very fortunate to have daily updates from our chief medical officers of our hospitals and health systems around the state. So we have a very good feel for that. I can tell you that certainly in Detroit, in Saginaw, in Flint, Grand Rapids, Lansing, all of those big cities that you may expect, but also in some of the rural communities in northern Michigan, like Traverse City and Petoskey, Marquette, and other places in the Upper Peninsula. These are places where it's not necessarily an issue of running out of hospital beds per se, but running out of clinicians, frontline caregivers that are able to staff those beds. And there are a number of reasons for that.
Yeah, and hospital leaders rightfully concerned for the health of staff. World News Tonight, just before our broadcast here, reporting that retired doctors and nurses are being asked to come back to work in New York City to help out. Could a scenario like that play out here in Michigan?
It's quite possible. In fact, we have a number of communities where frontline caregivers have tested positive for COVID. That's largely occurring because of community spread, not on the job. But regardless, when that happens and they're taken out of the game, that's certainly a driver. And we need to look at any and all innovative strategies to be able to ensure that there are appropriate staff capabilities. Whether you're in a rural community or an urban community, we need to have those staff present.
And Brian, what kind of cooperation is there among health systems to help each other out, and has that changed because of the pandemic?
I think we have a dynamic and a culture here in the state of Michigan where our member hospitals have always set competition aside at times of great need, and this is certainly one of those times. But I will tell you the real challenge is if you're a hospital in Lansing and you would have an interest in sharing frontline clinical staff with a hospital in Detroit or somewhere else for that matter, your ability to do that is severely limited by the fact that you're in the same boat. Now you have the same sorts of concerns as you see your beds filling up and your staff challenged to be able to be present on the job. So I'd say it's become a real challenge for us throughout the state.
Are you concerned we'll be seeing even higher numbers of cases and hospitalizations, probably deaths as well, because of Thanksgiving gatherings, for instance, and the Christmas holiday not that far off now either?
Right, and it's still a bit soon to tell. Of course, there's going to be a bit of a lag between those presumed social gatherings that occurred over the long Thanksgiving weekend and when we would start seeing that translate first to hospital emergency department visits, which of course is a precursor to inpatient hospitalizations, admissions, and the like. So we're still keeping a close eye on that. It should be a few more days before we have a better handle on that. But as you alluded to, we would again call on the Michigan public at large to really adhere to what we call the big three: the social distancing, the masking, the hand hygiene. If you can follow those protocols as you move into the holiday season later in the month, that's going to do wonders for our frontline caregivers and alleviating that second surge.
Vaccines are coming, we know that, but is there an ask beyond the big three that you just mentioned that you would make of people until we have widespread distribution of vaccines?
Well, absolutely. One thing that Michiganders can do as we head into the traditional flu season is make sure that you get that flu vaccine. There's plenty of clinical evidence over many years that those vaccines are effective and safe. And what we want to do here is avoid really a double whammy, if you will. If you have a COVID surge that we're absolutely in the middle of right now, compounded with a traditional surge from the flu. So if Michiganders can take advantage of that opportunity right away, as we're still waiting on that COVID vaccine to become widely available, that would be incredibly helpful.
And hopefully many will take your advice there. Brian, thank you so much for the time tonight. We'll look forward to touching base with you again in the future as we continue to battle this pandemic.
Thank you, and stay safe.
You do as well, sir. Brian Peters is the CEO of the Michigan Health and Hospital Association.